Violent protests rock cities across Europe as governments impose new restrictions to try to counter new spikes in COVID-19. Hello, I'm Anand Naidu, and this is The Heat. Austria returned to a full nationwide lockdown on Monday, the first EU country to take restrictions that far amid the latest wave of surging COVID-19 infections across Europe. And the new restrictions in Austria and elsewhere on the continent are being met with a backlash. From Croatia to the Netherlands, people took to the streets over the weekend to protest what they see as curbs on their freedom. Some demonstrations became violent, underscoring the level of anger felt by the protesters. But with cases up sharply, experts say governments felt compelled to act.
1,000.
It is estimated that there are currently more than 500,000 active COVID cases in our country, the highest number ever recorded. These are no longer isolated outbreaks. The whole of Germany is one big outbreak. We are in a national emergency situation.
Let's bring in our panelists to discuss the pandemic in Europe. From London, Beate Kampmann is the director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine. Here in Boston, Schernhammer is a professor of epidemiology at the Medical University of Vienna. Petar Cholakov is an associate professor of sociology at the Bulgarian Academy of Sciences. He joins us from Sofia. And from Berlin, Paul Hokenos is a journalist and author. Welcome to all of you. Eva Schernhammer, let me start with you. As I said, Austria has imposed a full lockdown on its citizens in an attempt to stop the spread of COVID-19. Only people involved in essential activities can leave their homes. What prompted such an extreme measure, and how are Austrians responding to it?
Well, first of all, this measure was prompted by staggering new infection rates, and the approach has been stepwise. So already 2.5 weeks ago, the first reaction to this really steep increase in new case numbers occurred, which was basically restricting anyone not being vaccinated from going to leisurely activities like restaurants or movie theaters, etc. Then, about 10 days later, it became clear that this measure had no effect. In the meantime, the restrictions for unvaccinated were further expanded, basically barring them from any activity, including shopping, other than they were still allowed to go to work. And now, since time is running out and our intensive care beds are so full that it's predictable that if we don't take immediate quick action, we will have a problem in our healthcare system. Now, starting today, actually, a full lockdown had to be implemented, impacting also the people who have gotten the vaccine for probably a short duration of time, and hopefully to bring these numbers down again quickly.
Right, so Eva, given this rise in numbers in Austria, what does that tell us about the level of vaccinations in the country?
Well, I think it tells us two stories. One is we do have fairly low vaccination numbers. We are at 65%, and we went into the fall with 62%. It's been very slow picking up anything there. So in some ways, this measure targeting unvaccinated to restrict their movement was also meant to perhaps encourage them to get the vaccine to increase that number. But secondly, an issue that Austria is facing right now, because we started our vaccination program in March, really March to May, June, is when most people got their first shot. We are now seeing this 6-month period where after which we see waning immunity, and we have this coming together of two factors, low vaccination rates to begin with, and now waning immunity among the already vaccinated, which really has triggered and spiraled these new case numbers. So we will get some relief as we are also increasing the booster rate right now.
Petar Cholakov, you are in Sofia in Bulgaria. The country has experienced the highest number of COVID-related deaths worldwide. That's in terms of deaths per million inhabitants. What is your assessment of the situation in the country right now?
The situation is improving. Currently, we have 733 people who got diagnosed with COVID-19. This is the data for 21st of November. But we have 833 people who have been cured officially from COVID. We have 73 people who unfortunately died from this disease. But as you mentioned yourself, just 10 days before that, the situation was much, much worse.
So, Petar, what can you tell us about the efforts to stop the spread of COVID-19? I mean, what is the vaccination rate like in the country, and how are Bulgarians responding to the program to vaccinate?
The vaccination rate, unfortunately, is the lowest in the European Union. It is currently approximately 26% of the population. And for the European Union, I can tell that the average is around 70%. So it's very disturbing data. And we had a visit from an EU commissioner, Mr. Thierry Breton, who mentioned that if urgent measures are not undertaken, it is not going to be a surprise if a new variant, a new version of COVID emerges in Bulgaria. So it could become a really problematic area.
Beate, the Austrian government is also requiring mandatory vaccinations that will start taking place from February 1st. And I'm wondering, how big a challenge is that, not just for Austria, but for other countries in Europe as well? Because we hear a lot of people say that, you know, when a measure like this is taken, it goes against their personal freedoms. In fact, there's been demonstrations in Austria. The far-right Freedom Party in the country is planning demonstrations against that particular order.
Yeah, so, you know, mandatory vaccination is really the last resort of trying to get on top of what is really a very worrying scenario now in Europe. The problem is, even with mandatory vaccination, you're not going to be able to catch up the current wave, because for full immunity to set in, you need at least one and better even 2 doses of vaccine, and they are spread over 3 months. So you're not going to be able to dampen what is currently a really worrying situation in Europe. And different governments have taken different approaches. In the UK, we've never had mandatory vaccination. In France, you can't go anywhere if you don't have a vaccine passport. So for healthcare workers, it's again a different story. So there's a bit more granularity to vaccination approaches across the European Union.
So, Beate, when we see things like a third and a fourth wave in some countries, is it because these countries have not reached a certain threshold in the number of vaccinations? And what is that threshold?
Yeah, I think we're really learning more and more that vaccines save lives. And in the UK, we're in a position where 85% of the population are now vaccinated. The booster campaign is progressing. And we are at, although we have worrying numbers of cases of up to 40,000 a day, the hospitalization numbers haven't increased dramatically. And that is because we've reached a level of community immunity that is protecting from new infections that are resulting in serious hospital admissions and death. That is very different in a country like Bulgaria, or even in pockets in Germany, and we'll hear from Berlin in a minute probably, where the vaccination rates haven't really increased substantially. And I think, you know, it was calculated from the word go that we would need to reach roughly 80% of the population to have a sustained benefit. And now we need to give the boosters to guarantee that that benefit continues to also have an impact.
Right. In fact, we're going to go to Berlin right now to Paul Hockenhaus. And Paul, Germany is seeing its 4th wave of infections right now. The country has been plunged into a national emergency. In fact, the country's health minister, Jens Spahn, is warning that vaccinations alone will not cut case numbers. So what are Germany's options right now? And could we see the country, which is Europe's biggest economy, go into the kind of lockdown that we're going to be seeing in Austria?
Well, the situation is not that much different than Austria. There are different parts of the country with vaccinations in the east and in southern Germany where the vaccination rate is very low, and that is exactly where infections are shooting out of the roof. I mean, there's really, everybody is unhappy with everybody and the government right now. You've got about 30% of the population that's not vaccinated. They resent the pressure being put on them. They resent the restrictions, and they resent lockdowns of any kind. Then you've got the rest of the population that is vaccinated. They're not happy with the anti-vaxxers. They think that they are primarily responsible for this 4th wave, which I think is justified. They're also not the least happy with the way the government has reacted. This wave was predicted by the experts, and loudly and clearly in past months, but the government let up, declaring more or less that the emergency and the pandemic was more or less over, letting up on mask mandates in schools, etc. The rollout of the booster shots has been extremely slow. So you've really got a situation where everybody, absolutely nobody is happy. It doesn't seem to be that there's going to be any short-term solution. And I mean, already you can feel that in the gastronomy business, for example, in restaurants and bars and clubs, the restrictions for getting into them are ever higher. Unvaccinated people are not welcome. Everybody else is being more cautious. So, I mean, it seems like we're headed for much the same as last winter.
Paul, when we look at that group of people in Germany, the group that's against vaccines, the anti-vax group, what are they suspicious of? What are they against? I mean, for instance, if we look here in the United States, the people who are opposed to vaccinations here, well, they don't trust vaccines for one, they don't trust government for another, and of course here it has also become very politicized. But what is the opposition? What is the motive for the opposition in Germany?
Well, it sounds very similar. I mean, one thing you can say is that it's very individualistic and it's very different. I mean, people who are on maybe the far left of the political spectrum don't trust the government for certain reasons and feel that the government is imposing on their freedoms. The people who are taking to the streets, however, they're more people from the far right. From the party, the AfD, the Alternative for Germany, is a far-right party that's represented in Germany's parliament. And they say that vaccines and masks are all a hoax and don't work at all. We've even got one of the new parties that's coming into Germany, one of the parties that's coming into Germany's new government, a Liberal Party, that's also speaking out on behalf of people who feel that they're being restricted, and that it's unfair then that the vaccinated people have restricted movements or are limited. So it's really across the board. There's some wild conspiracy theories out there, and again, just people who just don't feel that they know enough about vaccines yet. They haven't been tested long term and are, for those reasons, reluctant.
Eva Schernhammer, of course, scientists are looking at alternative solutions to what is happening right now. We've got pharmaceutical companies like Pfizer and Merck. They're working on a pill that would cut down on hospitalization and severe illness. What can you tell us about this type of medication, and do you think it will overcome the opposition that we're seeing to vaccines?
Well, I think down the road, these types of therapies will be very important because there will always be a proportion in any population that cannot receive a vaccine. And so it will be good to have such tools at hand. I do not think that at the moment, for the current wave that we are experiencing in Europe, that this therapy will come in time to alleviate the burden on our hospitals. But I do think what will come in time and will make a difference is booster shots given to the vulnerable populations as quickly as possible within the time frame when you do see waning immunity. And I did want to point out that considering only persons who can receive the vaccine, so anybody age 12 or older, the vaccination rates between Austria and UK are not so different. Because in the UK, the vaccination, fully vaccinated ones in that age, in the entire population, are also only 68 or 9%. So that difference doesn't make what we see. I think it's the booster shots where the UK just had an earlier time window to get those started than Austria, because they also started earlier with their AstraZeneca vaccines early in the year. So I think it's really this time window with the booster shots that's driving what we see in Europe right now.
Beate, if we look at the situation in Europe, more than 1.4 million people in Europe have lost their lives from COVID-related illnesses. There's been a study that's been done. It was actually done at the study where you are at right now, the London School of Hygiene and Tropical Medicine. It was published in Nature, and that study says if the continent doesn't follow anti-contagion measures and people revert to old habits, then the pandemic could claim up to another 300,000 lives. What can you tell us about the study and that warning that is in it?
Yeah, it's a very stark warning. This is work that has been put together by the modeling group at the Center for Mathematical Modeling at the London School of Hygiene and Tropical Medicine, and is also in combination with data that are available from the ECDC. And in fact, there's a very attractive tracker device tool that you can look up on the website with almost weekly projections of where cases, hospitalizations, and deaths ultimately might be going. And there are very, very obvious trends there. And this is, I mean, we need to say it is all a modeling study, and the parameters obviously have to be very carefully dissected that go into those models. If you look at the confidence intervals, they can be wide. But I think there's only one message. The situation is serious. We need to put all the public health measures in place that we know that are working. And we need to get as many people boosted and primarily vaccinated as we possibly can. And, you know, there is nothing that we have learned so much in the last 18 months about social distancing, wearing masks, in addition to the other measures, that it's really quite unbelievable that people want to throw all this knowledge back out the window.
Petar, Cholakov, you know, as we've been hearing, in some EU states, there's been a problem with vaccinations. Let's listen to what Marco Cavalieri of the European Medicines Agency had to say about that. Let's listen.
We should not forget that still in many member states there is a large portion of the population, including subjects at risk above 50 years of age, that are not yet vaccinated, and they are the ones that are most likely to go to the hospital and suffer from the consequences of severe COVID-19, including mortality.
So, Petar, there is clearly a divide in Europe, and if we look at some of the numbers here, in Western Europe, around 60% of the populations there are fully vaccinated, but that number drops dramatically when we move to Eastern Europe, where only 30% of the population is vaccinated. In fact, in Bulgaria, we have a number of, what, 26% getting the second
26.
shot.
That's right.
Yeah.
Yes, that's exactly right.
Yeah, how does one explain those big differences?
Well, there are number of reasons that one can point out. First and foremost, a recent study by Eurobarometer showed that 52% of Bulgarians believe that viruses are in fact developed by governments in order to control population. This is 52% of Bulgarians believe this. Furthermore, 1/3 say that they don't read, are not interested in science news or scientific news. So this explains that the population as a whole is very skeptical towards vaccines and the prevention that the vaccines provide. Another very interesting survey, which was conducted in the beginning of 2021, showed that almost 70% of Bulgarians are superstitious and they trust fortune tellers and oracles, which is, I know it's amusing probably in 21st century, but at the same time it has obviously grave consequences for the whole society.
And how...
Another thing that I would like to point out, just a sec, is that I think we also lack a stable political leadership, because in a situation like this, it's really important for political leaders to come up front and say that vaccines save lives. And the statistic is quite clear that if 90% of the people who have been vaccinated actually are protected from having another resurgence or from getting ill from COVID. And only the people who have not been vaccinated, they suffer from much higher chances of getting infected and falling ill. So there is quite clear statistic which supports this claim. And it is a job of the politicians to do this, but unfortunately, many politicians in Bulgaria refuse to do that.
Eva, we're also seeing a new wave of infections in some countries where we have up to 75% of the population that have been vaccinated, and that seems to be really worrying. What does that tell us about the efficacy of the vaccines?
Well, what we have learned is that this vaccine, even after the second shot, does not provide permanent immunity, but that it needs at least a third shot, which there is a time span, apparently 4 to 6 months after the second shot, where immunity goes down quite substantially, even more so for certain types of vaccines than others. And so I think this is something important we are learning. We saw this for the first time in the summer in Israel when they had an August wave, which coincided with their sort of 6 months post-second vaccine. But they had in favor a different climate. They were not heading into the winter as we are here in Central Europe right now. And they were able, with the booster shots, to really bring this wave down fairly quickly. So I do think this is something we learned, and looking down the road, it may mean that even a third shot may not be sufficient to provide longer-term immunity. And these data will probably also come out of Israel for the first country that has started with mRNA vaccines. And so there's more to be learned, and it means we are not yet at the end of this pandemic, nowhere near.
Paul Hawkenos, here we have in the European Union, rather. I mean, this is a grouping of more than 24 states. Is there a coordinated response to the pandemic, or is a kind of patchwork response from one country to another?
It's definitely patchwork from one country to another. In fact, even inside Germany, it is mostly the federal states, the 16 federal states, and Germany is a highly federalized country in which each is making its own decisions more or less according to its numbers. And just you can see very clearly that in those states where there are low levels of vaccinations, the cases are highest, and the opposite is true as well. The federal government is now and will be putting in emergency measures again, in which it will take more power to provide a centralized response. But there's no one single response across Europe. I'm not sure that it necessarily would be the right thing either. There are different situations and different conditions and different cultures and different trusts in the level of government from one country to another. So I don't feel that the same policies in Sweden would necessarily work in Bulgaria. They sound like completely different societies that would demand different responses.
Eva, what do you make of that? Does the EU need a single response, or is it okay to have different responses? Because as Peter points out, people are different from one country to another. They have different cultures, they have different behaviors.
Yeah, no, I did want to also add to the comments from Bulgaria that we, even in Austria, where we have fairly high vaccination rates comparatively, the ones that, according to latest surveys, that refuse to get vaccinated tend to be more from those parties who were not elected during the last election, or from people who abstain from voting altogether. And I think there is a real political aspect to who takes up the vaccine, with probably countries doing better where the government at the moment stands together and provides the same message across all party lines, which unfortunately in Austria is not the case. We do have a party that is sort of sticking out from the rest by providing mixed messages about vaccine and COVID-19, confusing people. So I do think that's important, and in some sense I think that's right. You wish for a concerted effort across Europe, but that concerted effort needs to be still flexible enough to allow for varying cultural or political systems, and I do think there's a mixed message there. In some ways, you do want to have an effort across Europe that keeps case numbers low, but yet allow enough flexibility for certain countries to modify those rules and measures that they take.
Right, Beate, we have seen the impact that the change in seasons has on the spread of the COVID-19 virus, and we are seeing a rise right now in the number of infections, but we have been warned about that, haven't we? Experts have told us that, look, as winter comes, we will see the infection rate going up, and of course, that's also complicated by the fact that it's also flu season. But, I mean, are these numbers expected, or are they much higher than we expected?
Yeah, I think, the influenza season is also upon us. And interestingly, we haven't seen as much influenza as we would have perhaps anticipated, but it's by way overridden by the cases of COVID that we're seeing. RSV is another virus that has very seasonal distribution, particularly affects young children and elderly people. So the winter isn't a good time to have other new viruses such as coronaviruses creeping into the space. And although we might be seeing less flu, surely the climate has also advantaged the spread of the coronavirus, as has the arrival of the Delta variant, which maybe also in Europe wasn't really around as much a few months ago, and is clearly a lot more infectious, and people are having to get on top of it now, when in the UK we had that wave during the summer already.
Petar, you were telling us a moment ago about the deep suspicion among certain groups of people in Bulgaria against vaccinations. We also know that the Bulgarian authorities have called for school children to be vaccinated once a week in the hope that that would speed up a return to in-person school classes. How is that being received?
It's not vaccinated, I have to correct you, tested.
Tested, sorry.
Yes, yeah. a week test.
Mm-hmm.
Well, to be honest, it's not received particularly well, and I think the biggest telltale sign for this are the recent elections for the parliament, where we have for the first time a very strong anti-vax party, which became part of the new Bulgarian National Assembly. And they received less than 5% of the vote. Yes, that's for certain, only 13 members of parliament from 240. But still, although they are the smallest political party, they're in. And just quite an interesting fact, which I'd like to point out, although they received less than 5% of the vote in Bulgaria, abroad, where there live between 1.5 and 2 million Bulgarians, they received more than that. They received approximately 6% of the vote. And in the United States, in the Orange County, of all places, this particular political party, which is very strongly anti-vax, received between 12 and 14%. I'm saying between because it is the data from exit poll. So it's very interesting data indeed.
Eva, we are also seeing a number of people get the third shot, also known as the booster shot. That increases their resistance to the virus. But we're also being told that over time, the effectiveness of the vaccine will diminish. So are we getting to a point where everybody's going to require an additional shot, a fourth shot?
Oh, definitely. Well, the third shot, definitely everybody will require. And a fourth shot, like I said, this is still to be investigated. We don't know yet how long this third shot will give us immunity. There is certainly hope that there will be longer-term immunity, but really we don't have the data yet long enough out after the third shot to know that for sure. And Israel, I think, will give us that first clue, since they got their third shot pretty much in August around this time. So probably in about 2 months or so, we will see the first data out there, whether again there's a decline in immunity or whether this one may last longer. But yeah, so I think we don't know that yet, and it's definitely something that we need to wait for.
Okay, and we have to leave it there. Thanks to all of you for being with us. That's all we have time for, but the conversation continues online. Chat with us about this or any other show on Twitter. We're at CGTN America, or visit us on Facebook. That's facebook.com/CGTN America. I'm Anand Naidu in Washington, D.C. Thanks for watching.